Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Today we are going to discuss about vaginal discharge. What is it? What are the different types? And does the type also tell us a lot about your physical well-being? Vaginal discharge is the fluid which comes out of the vagina and cervix, and basically it helps remove bacteria, dead cells from your vagina. It also helps in keeping the vagina clean and infection free. The type of vaginal discharge is very critical in understanding your well-being. During a menstrual cycle, the type of vaginal discharge also varies. For a menopausal woman, because the estrogen levels are very low, vaginal discharge is minimal or totally absent. So we are going to look at the types of discharge and what can we refer or what can we infer from the kind of discharge. First, try to understand during the menstrual cycle how the vaginal discharge varies. Before the ovulation period, that is around the ovulation period, the fluid becomes watery and fluidy. That's because it wants to make an environment which is feasible for sperms to swim up to the egg which is waiting in the tubes. After ovulation and just before the periods, the discharge becomes white and thick. This is because in case there is a pregnancy, the embryo is getting ready to implant inside the uterus. So this is how the discharge looks during the entire menstrual cycle. Let's look at the types of vaginal discharge. The first is white and thick. If it is white and thick, but it is also accompanied by itching, soreness, redness, irritation in the vaginal area, then it could be serious. It could mean that you have an yeast infection and you must consult a gynecologist immediately. The second is yellow discharge. If it is yellow in color, this discharge could mean that you have a bacterial infection or a sexually transmitted infectious problem. In these instances also, it could be accompanied by itching, soreness, irritation. You must consult a consultant or a gynecologist immediately. The next type is brown discharge. If you have irregular periods accompanied by brown discharge and you are around the age of menopause, it could mean something serious. It could mean cervical or uterine cancer. You must consult a gynecologist and get thoroughly examined to rule out any possibility of cancer. A discharge which is green in color is not good at all. Immediately consult your gynecologist. It could mean many kinds of infections. A green discharge is not safe at all. It could mean bacterial, sexually transmitted infections, etc. You must consult your gynecologist who will examine you thoroughly. So the most commonly occurring discharge which could be abnormal are yeast infection discharges, which are white, thick. Sometimes they could be cottage cheese like thick, and they could be accompanied by itching, irritation, soreness, redness. All these have to be paid attention to. You must consult your gynecologist who will do a culture sensitivity test and put you on the proper kind of antibiotics which are required for treatment of these problems. If you wish to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.